Good afternoon, dental professionals. My name is Charlotte Gallagher. I'm a certified infection preventionist with Philadelphia Department of Public Health, also known as PDPH. I have a diverse background in nursing and dental hygiene, and I am certified in dental infection prevention. I'm happy to present Killer Sterilization, a dental hero's path to zero infections. This presentation explains each step of the sterilization process so recontamination of instruments never occurs. Precise sterilization processes ensure patient safety by killing all living organisms, including infectious germs, and this prevents disease transmission and subsequent infection. After this presentation, you will be able to identify characteristics of a well-organized reprocessing area, explain the flow of tasks through the four individual areas, and finally highlight the importance of using manufacturer's instructions for use, for equipment monitoring and maintenance, and quality assurance guidelines. First, let's lay some groundwork for the entire reprocessing area by examining its required components. A designated sterilization area should always be separate from any patient care areas, and it should always follow a one-way flow from soiled or dirty to clean. The designated spaces will start at receiving decontamination, go to preparation and packaging, then sterilization, and then they should end at clean storage. Here is one map of a specific one-way flow of the stations. This map depicts a walled-off dirty area denoted with a thick purple line. You can see entry starts in the soiled receiving area where instrument cleaning will occur. Then, as we exit the dirty area, we enter the area of preparation and packaging, and then it flows into the sterilization area and finalizes in the storage area for later dispensing into the patient care areas. Clean products should never flow back into the soiled area. Here is a one-room diagram that shows the arrow starts the flow at the entry door, soiled area, and then the clean areas of packaging, sterilization, storage. Then there's another exit door. And notice here that there's a sink for decontamination and a sink for hand hygiene. This way, staff does not become contaminated at the decontamination sink while performing hand hygiene. Here's a commonly encountered sterilization layout demonstrating one-way workflow of the four areas of decontamination, prep and package, sterilization, and again ending at sterile storage. You can clearly see separation because there are signs that depict the separation of dirty and clean, and each one of the four station names. And using different colored lights like red for dirty and blue for clean is also an option to delineate separation of the areas. Certain items should be kept readily available in the area, like the hand hygiene supplies, required PPE, measuring cups for chemical dilution, and clean low-lint towels. Product and equipment manufacturers' instructions with their maintenance logs should be kept handy too. At the entry to the decontamination area, clean utility gloves, face shields or goggles with sides, masks, and fluent-resistant gowns are required to prevent splashes or puncture injuries during cleaning processes. Environmental safety requirements for the area are another consideration. This area requires a biohazard spill kit and an eye wash station that is monitored weekly. The eye wash fixture must be within 30 feet or a 10-second walk from high-risk tasks. If able, room air should also have an HVAC air exchange of 6 to 10 per hour with a temperature of 64 to 72 degrees Fahrenheit and a humidity between 34 to 79%. Unexpired cleaning products should also be handy and dated at opening. Please be sure to check manufacturer's instructions for the duration of effectiveness once the product is opened, and mark that date on the container as well, because in this case, the discard date becomes the new expiration date. Be sure to have a sterilizer and needle stick log in the area as well. At this point, let's discuss our first task, soiled instrument handling and decontamination in the first area of reprocessing. The cleaning process actually starts in the exam room when preparing instruments for transport to decontamination. Here, sort and appropriately discard single-use items and hazardous waste into sharps and biohazard disposal bins. To make cleaning more effective, prepare instruments by wiping off their tips during treatment with the moistened 2x2 gauze. This reduces drying of gross debris. This is called point-of-use cleaning. Once instruments are sorted, an enzymatic spray gel may also be used to reduce drying of blood or debris. Prior to air-water line detachment and removal of connected devices, the handpieces and air-water syringes should be flushed. Then they should be entirely removed for sterilization, if they are not one-time use. The entire handpiece, including motor, should be heat sterilized after each use because the CDC has determined that handpieces can retract patient materials into motor components that can later be transmitted to the next patient. Instruments should be transported to the decontamination area in an OSHA-approved container that is covered, leak-proof, puncture-resistant, and labeled biohazard. Never transport liquids. In order to decrease sharps handling, you may first place instruments into an ultrasonic basket, then place those baskets into the OSHA-approved container. This way, sharps are later placed directly into cleaners without handling them again. This eliminates an opportunity for sharps injury by reducing the number of times the sharps must be handled by staff. On entry to the first area, the decontamination area, instruments may be placed in a dedicated pre-soak container to prevent drying of debris when they are unable to be placed immediately into the ultrasonic. Remember, any dry debris or biofilm on instruments will prevent steam contact later when they are placed in the sterilizer. Whatever cleaning method is used, instruments should be prepared by disassembling, unlocking, and opening hinged devices. Also, follow manufacturer's instructions to properly irrigate, lubricate, or flush tubing with air. Here is an example of a commercial handpiece lubrication system that may be used to exact the process of flushing and lubricating handpieces. The three methods used to clean instruments are ultrasonic cleaners, washer disinfectors, or manual scrubbing. Manufacturer's instructions for use for each instrument should be considered for cleaning compatibility. Automated methods are preferred to decrease the injury risks while manually scrubbing. All instruments should be heat tolerant and sterilizable or one-time use to prevent exposures from infectious cross-contamination or hazardous chemicals. Ultrasonic cleaners clean by vibrations that cause cavitation bubbles to dislodge debris. Instruments are placed in a basket and lowered completely into an enzymatic detergent and water mixture. Do not overfill the basket. Then always put the lid on to prevent contamination of the air and surfaces with droplets or aerosols prior to starting the unit. The timer is set per manufacturer's instructions. It's usually about 15 to 30 minutes. As the ultrasonic maintenance, the detergent is precisely measured and filled according to the manufacturer's instructions in the morning and emptied and dried at the end of the day or anytime the solution becomes cloudy or odorous. Commercial testing strips are available to monitor each load's cavitation, temperature, and cleaner levels. But cavitation can also be quality tested with a daily foil test. Here are some pictures of an effective and an ineffective foil test. Be sure to document results in a log. The links for demonstration videos on foil testing are seen here. After a cycle completes, remove the entire basket, place it in the decontamination sink, and thoroughly rinse detergent off with tap water. Sharp should be retrieved or handled with forceps and utility gloves. Then transport items safely to a clean drying area. The second type of automatic cleaner is a washer disinfector, and this offers the highest level of cleaning and disinfection. It also saves time and eliminates risks by rinsing and drying. Commercial tests are also used to verify performance quality. Again, all maintenance and testing should be logged as performed. When manual scrubbing, scrub 2 to 3 items at a time with a long-handled brush and detergent. Replace the brushes daily or if damaged. If cost is a concern with brush replacement, consider using disposable toothbrushes. Never reach into water-filled sinks. Just use long-handled pliers and heavy-duty utility gloves for hard-to-reach items, and again, rinse completely. Next, place items on a lint-free dry towel or absorbent disposable pad to transfer them to a clean drying area. If air drying, be sure to keep instruments from the sink splash and recontamination. Lumens or tubed instruments may also be flushed with air to ensure steam can reach all surfaces. Complete drying prevents wet packs and corrosion, which are also forms of contamination. A rigid container may also be used to transport dry items to the clean prep and package area. Keep clean instruments out of the splash zone, meaning 3 feet away from the sink splash. And if there is limited space, keep dirty and clean tasks separate by disinfecting shared surfaces between uses or by using clean surface barriers and splash guards. For instance, you can see how close the soiled sink is to the prep and pack area here. But presto, alakabam, we can use a splash guard to prevent contamination. This is a great solution to an often encountered problem of limited space causing recontamination of clean instruments. It is important to not take contaminated PPE out into the clean areas for reuse. Discard all disposable PPE and reprocess utility gloves and shields or goggles, meaning they should be disinfected. You may write your name or initials on utility gloves with permanent marker for later individual reuse. If DOF gloves are laundered, if DOF gowns are laundered, place them in a nearby bin. Always perform hand hygiene after doffing any PPE, including exam gloves. Now more on the tasks of the second station of a well-organized reprocessing flow, the preparation and packaging area. Start preparing items in this clean, dry area after you perform hand hygiene and don clean PPE. Using good light and magnification, check to see if there are any cracks that may harbor bacteria. If debris is detected, return the item for complete cleaning. Don't wipe or smear the debris with towels. Be sure to discard faulty or broken items and replace them to complete functional instrument sets. Manufacturers may call for rust inhibitor or lubrication at this point, but be sure to wipe off any excess. Next, if you don't use see-through pouches with built-in internal and external chemical indicators, separate indicators should be inserted inside and on the outside of the packaging. These chemical indicators measure that time, temperature, and/or pressure parameters have been met in the sterilizer. They do not verify sterility. Verification of sterility is only achieved with biological indicators, often called spore tests. I will discuss more about them shortly. Next, labeling packages with the load number, sterilizer number, date, and operator's initials. allows for a recapture of all items on a failed spore test, and helps to enhance training for operator errors that may be detected. The wraps or packaging should be adequately sized, clean, dry, and kept intact. If you overfill packs, they may rip, and that will compromise sterility. To prevent recontamination and keep items sterile, pack less instruments or get a bigger package. Be sure to fold the pack precisely so that the steam flows through the pack. Don't overfold. Then they should go immediately into sterilizers, but for safety's sake, wrapped instruments may be placed in a bin marked clean, not sterile, to await sterilizer loading as soon as possible. Once cleaning, drying, and packaging are complete, we enter the third area in our one-way flow, the actual sterilization area. Place the packages on autoclave trays with paper up or down according to the manufacturer's instructions, but they are often best processed standing on one side, as shown here. Remember, don't pile the packs and overload trays. This causes wet packs and ineffective steam contact. End of cycle. Wet packs wick or pull bacteria back into the pack, so they are rendered contaminated. Next, the sterilizer is set for the time, temperature, and pressure indicated by the manufacturers. Check the door seal for integrity and fully lock the unit. Of course, then we will run the sterilizer cycle without interruption. As the sterilizer runs, operating staff should watch the mechanical indicators to ensure that the parameters for temperature and pressure are maintained for the accurate amount of time. If mechanical indicators are not met, review the process for improper packaging or loading by the operator and rerun the cycle. If the parameters are still not met, the unit may require service before it completely breaks down or fails a spore test. As the cycle ends, be sure to open the door slightly or leave the door closed per manufacturer for adequate package drying and cooling. Taking packs out too soon or placing hot instruments on a cool counter can cause condensation and wet packs. Remove the cool, dry instruments with clean or gloved hands and inspect that the chemical indicators are changed. Again, end-of-cycle wet packs wick or pull bacteria back into the pack, so they are rendered contaminated, and they will require reprocessing. As far as documentation goes, maintain up-to-date sterilizer logs that include mechanical and chemical monitoring for each load, and at least one weekly biological monitoring spore test, which will be discussed later in the presentation. Also document daily preventative maintenance. Depending on which sterilizer is used, manufacturers may recommend you check drains, filters, or gaskets daily. They may also recommend that a Bowie Dick air removal test is performed. All contracted scheduled maintenance and emergency repairs should also be documented. Here's an example of a PDPH sterilizer log. This link connects to the log on our PDPH Health Information Portal. Furthermore, it is important to note that sterilizing unwrapped instruments is only acceptable if they will be used immediately. This flash sterilization process should not be used to save time or money. Also, storing instruments unwrapped compromises sterility. Now, a special consideration about cold sterile. Some offices are still using glutaraldehyde or cold sterile solutions that are high-level disinfectants. Their use is discouraged because health risks outweigh benefits, and it's actually cost-effective to use heat sterilizable or disposable instruments, because cold sterile instruments need to be rinsed copiously with sterile water to prevent chemical exposure to patients, and even then sterility cannot be verified or maintained. If you must use the cold sterile method, safety data sheet regulations must be strictly followed. Document quality monitoring of the product and environmental air quality must occur to prevent injury. The dilution, temperature, varied immersion time monitoring, HVAC room air exchange requirements, and safe disposal make its use complicated. Overall, buying heat sterilizable and disposable instruments is the safer course for staff and patients. Storage is our fourth area and the final area of our well-organized flow. Be sure to never store instruments with any packaging that has been wet, torn, stained, or has failed chemical indicators. Storing packages in clean, dry, and closed areas away from sources of contamination or degradation like aerosols, droplets, water, windows, or direct sunlight maintains package integrity and consequent sterility. This fourth area of sterile storage should also maintain a temperature of less than 75 degrees and humidity of less than 70%. Also, store items in a fashion that prevents packages from being crushed, bent, compressed, or punctured, and rotate packages as first in will be first out. When dispensing the packages, handle them with clean hands and re-inspect them for package integrity. If a package rips or is open before immediate use, take it back through the reprocessing. In other words, if the package cracks, take it back. Air and dust contaminates instruments in open packaging. Now let's discuss the killer and killer sterilization. Biologic indicators or spore testing is the only way to ensure sterilizers are absolutely truly killing all living organisms, including those that cause infection. We have options here. Spore testing may be completed in office, which will require the purchase of an incubator, but gives a quicker 48-hour or less response to indicate failed sterilizers. Consequently, there will be an improved rate of sterilizer replacement or repair. The number of instrument packs that should be recalled and the number of patients potentially exposed is also reduced. But there is also off-site mail-in labs that will give unbiased third-party test results in 1 to 2 weeks. I advise you to please research these options closely prior to making choices or changes. Let's talk more about components and frequency of the vial or strip tests. Both vials or strips contain a live, difficult-to-kill bacteria that thrives in high heat temperatures. Regardless of which spore test your equipment manufacturer calls for, there is always one test strip and one control strip. The spore test should always be taken from the same lot number found on the same test box. As far as frequency goes, the test should be performed weekly, whenever a surgical implant is sterilized, or when a new staff will be operating the sterilizer. Also, new equipment or packaging is implemented. That should be rechecked too for the biological indicator. Test vials are typically placed in the center of a load in each sterilizer weekly. The process of reading results is confusing because a past test vial fails to grow. The test vial is always sterilized, but the control vial's job is to show that the test set contains a spore that is able to grow, so it's not sterilized. Then both are incubated to see if there are live bacteria growing. Since the control vial isn't sterilized, it absolutely should demonstrate growth on incubation. But the test vial should not grow after sterilized and incubated. If growth doesn't occur on the control vial, the entire test fails. Please get a new test from a new box with a new lot number and repeat the test. Again, no growth on the test vial indicates a passing score for the sterilizer. Growth on the test vial indicates a failed sterilizer because it did not kill the heat-resistant bacterial spore. If we have growth in the test vial, it indicates either the sterilizer is failing and requires evaluation and replacement, or there could have been some operator error, and this is usually the case. So first, assess for any operator error in packaging, loading, method, or settings of a well-maintained sterilizer. To assess this, manufacturer's instructions should be reviewed and strictly followed with a new load. Then reprocess and retest. If the spore test indicates no growth, then resume sterilizer use. A second failure indicates an absolute failed sterilizer. The second failure requires that the sterilizer be taken out of use. A vendor may be able to replace it with the loaner until the existing sterilizer is repaired and verified effective by passing 3 empty cycle spore tests. Meantime, all instruments processed since the broken sterilizer's last pass date must be recalled, recleaned, repackaged, and sterilized in a fully operational sterilizer. All patients exposed to contaminated instruments should be notified about the risks of potential exposure and means of testing or potential treatment. We at PDPH should also be notified of potential breaches. The CDC link here gives more guidance on this notification process. Again, it is important to keep that spore test record up to date with weekly testing results, failed test responses, and mechanical and chemical indicator monitoring results. The log should also contain maintenance and repair invoices. These records should be kept at least 3 years. Last but never least, let's discuss administrative quality controls that prevent infection and harm to patients and staff. Not if, but when you create reprocessing and sterilization policies and procedures, base your policies and procedures on manufacturer's instructions and keep them available for easy staff reference. Review those policies yearly and whenever new processes are implemented. The policy should always include reprocessing training of staff on hire, yearly, and with any new items or processes. It should also include some skill checks for competency validation. Maintain records of training at every occasion. Here is a link for an education tracking sheet. Finally, good infection prevention and control programs require frequent auditing with feedback and follow-up education. This audit practice assures continuous quality compliance. In summary, effective decontamination starts in the exam rooms and ends with complete rinsing and drying. A one-way reprocessing flow, correct use of PPE, cleaning and disinfection prevents instrument recontamination. All instruments and supplies should be heat sterilizable or single use. Mechanical and chemical indicators assess adequate sterilizer parameters are met, but sterility is verified only by weekly spore testing. All instruments and supplies should be sterilized and stored packaged. And finally, sterilization policies are guided by equipment manufacturer's instructions and include all documentation of equipment testing and maintenance and staff training on reprocessing duties. Thank you for your time and attention today. Are there any questions? Any questions in the chat? Okay, that's a good sign. Here are a lot of web resources to help you with your best practices. Thank you very much for your time and attention.